Hello everybody. I'd like to just quickly introduce myself and of course our guest speaker for tonight, Dr. Aimee Reiss. So as Roger had mentioned, my name is Chris Kapreski. I'm an undergraduate at Emory University, and I work with Dr. Krishnan's research team, which is partnered with the amazing support group here. Dr. Krishnan's research team focuses on what we call patient-centered outcomes research. Some topics that we study include comparing effectiveness of rehab following stroke across various settings, the management of caregiver burden following neurological conditions, and the prevention and early detection of secondary complications following stroke. So I'd like to now introduce our amazing guest speaker, Dr. Reiss. Aimee Reiss is a doctor of physical therapy, a neurologic certified specialist, and certified wellness coach with more than 20 years of experience. She formed an online and virtual business called The Chronic Wellness Coach to help individuals living with a chronic condition and their family caregivers live as well as possible. The primary focus is to help individuals improve their well-being in many areas of health, including physical, mental, social, spiritual, and financial. If you'd like to learn more about the Chronic Wellness Coach, feel free to visit Dr. Reiss's website called thechronicwellnesscoach.com. I will also include this website in the Zoom chat for your future reference. Before we start, I'd like to remind everyone to please mute your mic during the presentation, unless, of course, you have a question, and this will just help us prevent any unnecessary noise and feedback. And I'll now hand the mic over to you, Dr. Reiss, and thank you so much for coming.
Thank you. Thank you. And I recognize some names and faces here. So actually a couple of the people in the audience, I think have heard this or heard a similar presentation. So it's interesting to see how everybody, the different groups do kind of overlap or intermix with each other. So I'm going to share my screen. Can everybody see that? Yep. Okay. As this is actually a pretty big group compared to some of the other presentations I've done over the last several weeks or few months, but I would like some engagement or discussion. And so there'll be a couple of spots in the presentation where there are good places for people to share their stories, kind of like Roger was referring to a little bit. If you are okay and comfortable sharing a little bit of your journey or how stroke or brain injury has affected you in your recovery, I would encourage you to participate. And for those who just want to listen, hopefully the discussion will help you maybe gain just a little bit of acceptance of where you are and what's happened. And that's really the whole point of what I try to do as a wellness coach is, again, to work with individuals who are managing stroke or brain injury or other chronic conditions, just live as well as possible. And so I'll go ahead and get started because I know we're kind of on a tight schedule. I do have a few slides, but if we don't get through all of them, that's not a big deal either. So we're just going to go ahead and get started and see how far along we get here. So as Chris mentioned, I am a doctor of physical therapy and a certified wellness coach. And really how I kind of got to this point in my career is when you're a physical therapist in a traditional setting, a traditional outpatient setting, you really only get to treat the physical problems of your clients. And so you work on walking and you work on leg strengthening or transfers and climbing stairs. And you don't even get to work on the upper part of the body most of the time. And what I found was that when people are living with stroke and the deficits from stroke or brain injury have not gone away, you know, they are limitations that persist, that begins to affect many areas of someone's life, and of course their caregivers as well. But there's really no place in our traditional healthcare system to help people deal with all the other side effects or consequences of managing a chronic condition. And so becoming a wellness coach kind of allows me to get out of that traditional treatment mode and to work with clients on things like improving their mental well-being if you feel like you're under a lot of stress, managing your stroke or brain injury, working on things like feeling disconnected or very lonely or isolated, Maybe you're just struggling to find peace with what's happened or peace with what your future may look like, and things like of that nature. So I like to show this quote because it kind of summarizes what I do with the chronic wellness coach. And it says that saving and prolonging life incur an obligation to accompany patients on their illness journeys to care for their souls as well as their bodies. And so, what this is essentially saying is that as technology and medicine has improved, people live longer, and that's a good thing, but they may live longer with deficits and limitations. And it's not just enough to say that someone has survived. It's not just enough to say that, we're working on their physical health. We have to take into consideration that whole person, their whole well-being, to help them have the best quality of life as possible. And so that means we need to address their mental health, their social health, their spiritual health, and even their financial health when they're living with living with a chronic condition. So if I take that quote and kind of put it into a picture, this is what it might look like for someone living with a chronic condition. This is not the only experience, but as I've talked with several stroke survivors and brain injury survivors, most have said that, this pie represents most or part of their journey of what they've gone through after their injury. And so if we start in this physical part here, after you've had your stroke or brain injury, the first several weeks or months are usually spent intensely working in your rehabs, like your physical therapy, your speech therapy, and your occupational therapy. And so much focus is on those first several months of healing. But for some people, those physical impairments resolve and they may persist. And so you may not get back to what you consider your normal. And so when you're working so hard on the physical part, but then you begin to realize that some of these deficits persist, it can lead to a lot of mental stress for stroke and brain injury survivors. So you may be very frustrated at the progress that you've made or not made, angry at the situation, depressed over what's happened or what you've lost, irritable if you're not sleeping well. You may be grieving what you've lost or who you thought you were before the injury, or feeling very anxious about the future. And what you can see in this pie is that when you're working so hard on getting the physical stuff back, and then that leads to a lot of mental stress, there's not as much time left for your social well-being, really addressing some of your spiritual health and finding peace with or acceptance with what's happened, and even financial. That can cause a lot of stress as well too. If you can't return to work, obviously that can be a cost to you or your family, but there's also a lot that just goes into, we identify some of us identify so strongly with our work and what we produced and what we gave through our work before an injury, that to not be able to go back to it is sometimes a big hole in someone's life that we don't really address very well in our traditional healthcare system. So financial can definitely mean cost, but it can also refer to kind of an identity crisis sometimes when you can't go back to the work that you used to do, and how suddenly sometimes, or really all the times that these things happen. You went to work on Monday and you had the stroke on Tuesday and you never went back to work. That's a very, very big disruption in someone's life, a group of people that you used to see every day that now you may not feel like you connect with very well or see very often. But I had someone say to me at one of the groups I was working with, which I thought was a really nice way to put it. My pie looks all nice and lines and separate parts. And their point was that it's really almost like a watercolor. If I could make this a watercolor of all the parts kind of meshing with one another, because all those things might be considered financial on my pie, but they cause a lot of mental distress or social awkwardness at work. And so really, even though I have these kind of clear designations in my pie, these different areas can overlap or kind of bleed into one another for different people. And, I don't know if we have caregivers on the call, but I did just want to, mention that caregivers can also go through a similar experience. Their pie might look similar, but a little bit different. And so briefly, if there are any caregivers on the call, for caregivers, a lot of times the mental part or their mental health is what suffers first, because all of a sudden you're taking care of someone's medical problems, medical issues, and it's a big learning curve. And you may be juggling that with your own work or that with your own health problems, or maybe you're taking care of a loved one and children or parents at the same time. So for caregivers, they can experience obviously a lot of stress. They too may be depressed about what's happened, anxious about the future, overwhelmed with all the different things that they're trying to take care of, and can often just get lost in a lot of negative thinking, negative thoughts. When that mental health, when there's that stress persists, caregivers are actually at risk for physical problems. And so they may develop high blood pressure that they didn't have before. They can also often feel fatigued. They may gain weight because they're not able to exercise or get that physical activity that they did before. And persistent stress can cause stomach problems, chest pains, rapid heartbeats. These are all different physical problems that a caregiver may begin to experience after caregiving for a little while. So again, for them, maybe the mental and the physical parts of the pie seem to be dominating, taking up a lot of time and energy and attention. And as with the survivor, there's not as much time left to nurture social relationships. They may be struggling to find peace with watching a loved one suffer or with what they've had to give up to become a caregiver. And then financially, they may have some different issues. Again, they may be juggling trying to perform at work while caregiving. And then there can be a whole host of financial planning or issues like insurance and choosing the right insurance from one year to the next, realizing what's covered, what's not, estate planning, a lot of big financial issues that maybe you weren't ready to just weren't planning on something like that happening. So whether you're a caregiver or someone who the survivor yourself, the reason these things are important is because it affects your quality of life and it affects your ability to live as well as possible. And again, as I mentioned before, there's really no obvious place in our traditional healthcare system to address this for patients or their families, and treating the whole person to help them live as well as possible. And that is, one of my mottos with the chronic wellness coach is that in spite of difficult circumstances, you can find areas of your life to thrive. You can find new possibilities after injury, and you can try to live as well as possible. So I'm going to stop here for a moment and just ask those, especially those who maybe have not heard my presentation before, to just consider what your pie would look like if you were to draw your own pie right now. And or your pie can change. Maybe it looked different at the beginning, closer to the injury, and it's changed. And I know COVID has changed that pie for some people as well. But if you took a couple of minutes and thought for yourself, what would your pie look like? And then maybe we can open it up for discussion if anybody wants to kind of talk about, does this pie represent what you have felt? Does it seem to speak to your story? Are there parts missing? A great part that has not been brought up before about the barriers of returning to work. That has not actually been brought up before in any of the stroke or brain injury support groups have done this year. And so any feedback or a discussion that y'all want to have about this, I think it helps to talk through it, to kind of recognize part of your journey of what you've been through. And it may help those who are a little bit newer, whose injuries are a little bit more recent, feel like they're not alone if they're experiencing similar things like this. I think it's a difficult time when you're in the hospital to address some of these things because things are so variable still when people are leaving the hospital. And when I say leaving the hospital, I'm thinking within the first month or so of stroke. Some people are in acute care for a few days and they go home. Some people go to inpatient rehab and they're typically there for, a month or so. And then they go home and maybe start outpatient therapy. And it is kind of difficult when would you bring this up for folks because they're in such different places in those first several weeks after injury. And as I was mentioning, the thought for many people is I've got to work as hard as I can to get better. And so that's why they're so focused on the physical therapies, the occupational therapies, and the speech therapies. And what I also know people get told a lot, their doctor will say, well, whatever you're going to get back in a year is what you're going to get, or whatever you get back in the first 6 months is what you're going to get. And so that it's like a ticker in someone's brain. They've got to work as hard as they can for that 6 months or that year. And so it's difficult to know when to bring up some of this for people because I think they have to work through that physical part. They have to try as hard as they can to see what they're going to get back. And some people will get it back, right? Some people do return to what they would consider their normal before the stroke, but many do not. And by the time that you get to that place where you're realizing, okay, some of this stuff is going to persist. I'm not going to go completely back to who I was before the stroke or the brain injury. Well, now you're already out of therapy probably, or maybe you're just seeing your doctor once or twice a year for a checkup and it's not getting addressed anywhere. And so I'm trying to fill that gap or kind of reach people in the right place, but it is a little difficult because everybody's experience is different. And I think you, sir, bring up a good point. For some people, they do need a licensed counselor, or they need something more substantial than what I do as a wellness coach, because there are some deep issues or traumatic stress that you're dealing with from something that happened so long ago. So everybody's case is a little bit different. And I can't say that wellness coaching or what we're talking about here would be absolutely appropriate for everybody. But I do think it has its place, and it's trying to find people when they need it. And people need it at different times. And because it depends on the severity of your limitations and just your mental or outlook to begin with. So I think you've almost got a little bit of both there, that it's good. I think that you're in the counseling to work through everything that happened with your mother, and then kind of recognizing what your wife is going through too. It's a lot. You've got a lot to deal with for sure. Another quote that I liked, I don't have in this presentation tonight, but I was listening to a podcast with stroke survivors recently. And the lady, the stroke survivor, just said, very plainly, but it's so simply, you have to feel to heal. And that if you're not acknowledging your feelings, and so for you, you're acknowledging it's more anger than fear or anxiety. But if you don't allow yourself to feel your anger or your grief or your sadness, frustration, and you keep kind of bottling that up or trying to shove it down, it can explode later. It's going to come out at some point. But if you just let yourself feel those emotions, as negative and as uncomfortable as they are, that's actually maybe part of the healing process for a lot of people. And so I think that's part of what you're maybe alluding to, sir, is that you've had to acknowledge your anger and let yourself feel it and understand where it comes from to begin to get past it. And it's getting past some of those negative feelings that may help you find acceptance with the stroke. And acceptance does not mean that you'll not continue to make progress. It just may mean that you're not resisting what's happened. And because resisting can actually sometimes increase your suffering with your experience. And if we make an assumption a little bit that for many people, their social circles maybe have shrunk, or they just feel lonely or isolated or disconnected after their injury, then let's just focus on social suffering just a little bit. Again, you may feel a lack of connection with family or friends after the injury, lonely or isolated. You may feel like some relationships have become unhealthy. It's, you know, sometimes we're involved in toxic relationships where someone needs a lot of attention from us when we're dealing with our own stuff. That can cause a lot of conflict. You may have anger or resentment or finding difficulty just enjoying things. And so, how do we maybe address social suffering for survivors and even caregivers after injury? Um, so, we don't have a lot of time. I'll just kind of briefly mention a couple of things. One quote that I've found from, in kind of researching and reading different stories from survivors was one that said this. And this was actually, I think, from a parent talking about caregiving with their child. But they have learned not to regret the things that they can't do, but to focus on the things that they can do and then do it. And actually, as Roger and Kelly were talking about the Shepherd Centers and their adaptive clinics, that kind of reminded me of this quote. You know, you may not be able to do things exactly as you did before, but are there different ways that you can enjoy similar activities? Or have you thought about trying one of these adaptive clinics? Maybe you've kind of hesitated, um, even going out there and trying to do things like the water skiing or the tubing and those type of things again. But you know, for some people, you know, they may very well very much enjoy nature. And so the example that this mother gave was they used to like go canoeing and kayaking together. And because of her son's condition, they couldn't do that exactly anymore. But they were able to kind of figure out a different way to enjoy nature, which was sitting on a bench near the water and just watching the water go by and being out in nature. So as you think about, you know, your social connections and maybe how things have changed after your injury, is there a different way that you can enjoy things that you used to do before? Or would you consider doing something like the adaptive clinics where you might need a little help, you might need special equipment, but you're able to get back out there and do something that used to, you know, essentially boost your spirit or nurture your soul? So it's important to think about those things that you used to enjoy to do and see if you can open up your mind to enjoy those things in a different way. I think it's also important to consider building new connections. That's essentially what you all are doing as part of these support groups, is that you're learning or you're finding ways to connect with people who maybe have similar experiences, slightly different, but similar experiences with you. And so I think support groups are really important, but you can find different groups online through Facebook, Instagram. You can feel like a part of a group even listening to certain podcasts. When you listen to the same person or same people talking about different topics week after week, you start to feel a connection, even though it's not an in-person one. And it doesn't always have to be about stroke or brain injury. And so, what are the things that you're interested in? Where can you find people who have similar interests to you, that you don't necessarily have to see in person if you can't? And so, it's maximizing those online or social media type platforms to build connections, whether it's related to stroke and brain injury or just something else that you're interested in. And so, how have you all, especially I think during COVID, a lot of us felt very disconnected and isolated. Have some of you found ways to make connections during COVID or to make that adaptation to stay connected to people or to find new ways to connect to people? And I've had several people say that they went into a depression after COVID. And I think in part because after the stroke or the brain injury, people had struggled to get to a routine that was working for them. And then just kind of like the stroke and the brain injury, everything changed suddenly. I mean, it was a pretty quick change with COVID. And there was so much uncertainty involved with it. And, you know, a lot of fear over what was happening, uncertainty about when it would end and when things would be safe again. I do think we're, hopefully turning a corner a little bit, but I think you bring up a good point about routine. And in fact, I moved to this screen here. There is actually research out there that correlates routine with happiness, and that it is important to have a routine that um, it improves your wellness or helps your well-being. And again, I like to kind of say it as nurturing your soul or boosting your spirit or helping you feel productive. But as we start to maybe see a light at the end of this tunnel with COVID, I think it's a good time to be thinking again about when can you begin a routine? You could start a routine tomorrow, by adding in one thing that makes you happy or helps you to feel good or brings some type of good into your life, that you start adding these things back in. And so I don't know if adaptive golf necessarily is open, but looking for those things that are beginning to open up again that you enjoy doing before and getting back into a routine. Because again, there's actually an article in the New York Times fairly recently making that connection between routine and happiness. Part of the reason being routine gives us stability. It gives us something to count on. We feel secure with routine. And of course, COVID was a year of such uncertainty and anxiety. And so, where can you begin to add routine back into your life that helps you on that process of getting back to wellness and well-being and prioritizing that for yourself? And I think it's also important to think about too, some of these events that you all have coming up, like these cookouts and things. It's really more, if you still have some fear and anxiety about COVID, it's maybe a little bit more about physical distancing instead of social distancing. You can start to see people again, especially if you're vaccinated. And but you can still physically distance or wear your masks or do those things that help you feel secure and safe, but begin to be in other people's presence. um, Maybe start to decrease some of the virtual interactions and start actually seeing people in person, still physically distanced if you want to, still wearing masks and things if you want to, but kind of realizing that we are rounding a corner. And so your behaviors can begin to change if and when you're comfortable with that. So I think that's a good place to be, and to start thinking that way and how you can move forward a little more positively in the second half of 2021 than we've been able to in the last year and a half or so. Just briefly, if you all want to check out my website, it's thechronicwellnesscoach.com. I am on Facebook at the Chronic Wellness Coach. And if I have just a moment here, I've offered this on the other stroke support groups that I've done. So I just, as a thank you, and it also does help me. But this is kind of like Chris and Justin doing their appreciation moment earlier in the presentation. As a thank you for coming and being a part of the discussion. I do offer 2 free coaching sessions for anybody who's been on the phone call or the meeting. What we do is we kind of work through, basically we kind of look at what your pie looks like, and try to identify areas that maybe you need to work on or that you want to work on particularly. So it's not, even though I'm a physical therapist, it's not a typical visit like with a PT or a doctor where you come in, you kind of list off some problems and I tell you what to do. It's a very collaborative interaction. Wellness coaching is very different from traditional healthcare that way. And it's kind of like a personal trainer for your well-being. Sometimes you just need someone to kind of help hold you accountable, to think about where in your life you need to kind of balance things out or how you want to move forward more positively, and how to put an action plan together. So oftentimes I work with clients on how they might want to decrease their mental stress, how they can build better connections with their family, friends, or community. A lot of people struggle to find acceptance or peace with what's happened, or they don't know how to move forward positively. So those are things that we talk about. And then one gentleman I'm working with right now, he's ready to be Paul 2.0, right? He's ready to just do something different moving forward. And so we work on things like that. And so if you're interested, I will ask Roger or Kelly or someone to just send out my email, or it might have been on the email for this link as well. But you can email me directly and just let me know if you're interested. The sessions last about 45 minutes each. So your total time, working together would be 2 hours or so. And we try to do it within a month to have some consistency in our conversations. So again, if you're interested, please email me. And thank you all very much for your time. And Roger and Kelly, thank you for inviting me. And it was very nice to speak to the group. And I'm sorry for the people that had to they've heard me talk before. But it's nice to see that the groups kind of overlap and interact with one another. So it's good to see some familiar names out there too. So thank you all very much.